edition of the Dr. Sisi show, and we will be continuing cervical cancer. I told you that this month, January, is cervical cancer awareness month, and so last time I talked about what cervical cancer was, risk factors for cervical cancer, and what causes it. Cervical cancer, like I said earlier, I'll just do a quick recap, is cancer of the cervix, and the cervix is the entrance of the womb. It's the part of the womb that opens into the vagina when you go down below, and cervical cancer is as a result of abnormal growth of cells in the cervix out of control of the body, and so they keep on growing, and with time it starts spreading around the body. So we also said that cervical cancer has been linked with human papilloma virus. Is a virus that has over 100 types, but the type that is linked to cervical cancer is gotten through sexual contact. And normally, human papilloma viruses, most people actually have them, but they're able to withstand the infection because sometimes it doesn't cause symptoms. In some people, it causes warts, but in others, it causes cervical cancer. And so we also said that there are risk factors for cervical cancer, like multiple sexual partners, early age of sexual exposure, women who have given birth to more than 3 or 4 children, women on long-term use of contraceptives, and all that, and even smoking, which has been linked to other cancers. So today we'll be talking about symptoms. How do you know you have cervical cancer, or what should you know make you think towards cervical cancer? First of all, we have abnormal vaginal bleeding. Yes, when we say abnormal vaginal bleeding, we mean blood coming out of the vagina in between periods. That means you've seen your period 2 weeks ago or a week ago, and then you're seeing another bleeding. Bleeding that occurs during or after sex. Bleeding that occurs after menopause. That is, you've hit your late 40s, 50s, and all that. You've stopped seeing your period, and then all of a sudden you see fresh bleeding from your vagina. Pardon my words and all that. We know what it's health talk, So and so these are symptoms. This bleeding from the vagina that's abnormal is a symptom of cervical cancer. And when you see this abnormal bleeding, you should not just sit back home and think it will go away. You should go see your doctor. Also, we have pelvic pain, abnormal pelvic pain. Most times, most ladies have lower abdominal pain during periods or just before their periods. But when it becomes abnormal, becomes too frequent, then you need to see your doctor. It could be a symptom of cervical cancer. There's also vaginal discharge that is very purulent, and we call it very purulent, meaning that it just comes like water. And even after treating for infection, it doesn't go away. This is a pointer that it may be cervical cancer, so you should go see your doctor. So these are the basic symptoms of cervical cancer. Then when it becomes advanced, that when it has gone on for a long time, it can cause anemia. That's low blood count. Your blood becomes low, becomes short in the layman terms, due to continuous vaginal bleeding. There's also back pain, lower waist pain, and pelvic pain also. And there's also weight loss. Cancer causes weight loss most times because there's always a loss of appetite, and then the cancer cells are also taking a large part of your blood source and all that. So these are symptoms and pointers that will show that it may be cervical cancer, so you should go see your doctor. And then when you go see your doctor is likely to ask some questions, about the symptoms and about what you've noticed. He's going to do an exam, a pelvic exam, most importantly, and then at that point, if he has the tools to do a pap smear for you, he will do a pap smear. He will do a pelvic scan and then do a pap smear, scrape some parts of the cells of the cervix, and then send it for likely for histology. And then when there are early changes, early cell changes in the cervix, if they are noticed, there are things that can be done, to treat that. But when it becomes advanced, then your doctor knows what to do. The key to curing cervical cancer is early detection, and that is why it's advised that you do a regular pap smear if you are 18 years and above. A pap smear is what I just described, where a doctor takes part of the cells of the cervix and then sends them for tests to know if there are cell changes in the cervix, or if there are cancer changes. If they're just cell changes, abnormal cell changes, or cell differentiation, this can be solved. But if it's cancer changes, then your doctor knows what next to do. Now, if it's just cell changes, like I said, there are things to be done. And if there are no cell changes, this is where we advise ladies who are 18 years to 25 to go for the HPV vaccine. This vaccine has been known to prevent cervical cancer. So if you can do your pap smear and then you are clear, you're in the clear, you can go for your HPV vaccine. So that is why early detection can actually bring about a cure. Now, for the cervical cancer, those who have been diagnosed to have cervical cancer, there are modalities of treatment. That is, there are ways that these can be treated through surgery, chemotherapy, and radiotherapy. I will explain. Surgery is geared towards removing the whole womb so that you're removing the source of the cancer. And then after that, if it's very advanced, you may need to have chemotherapy. That is drugs to take care of the cancer cells that have spread around the body. And to top that up, you would have to go for radiotherapy, where X-ray rays will be used to, try and kill off the cells that the eyes cannot see. So these are the modalities of treatment for cervical cancer. And we said earlier the symptoms. So it's for you to be aware, for you to be informed and know cervical cancer is real, and you can prevent it by doing a regular pap smear test, especially if you're 18 years and above. Now, if you have questions you want to ask and you're very confused about cervical cancer, you can send me a mail on drciciblog at gmail.com. It will be on your screen soon, drciciblog at gmail.com. But subsequently, I'll be taking some frequently asked questions like how do I know I have cervical cancer, what to do, and all that. I'll be featuring that very soon. Do have a lovely day and stay